insipidus. This, our regular diabetic, you get like a 3 up to 3 liter or more than 3 liters. And in addition to that, in normal people, in urine, you do not see any sugar in there. But diabetic patient, you have a glucose in the urine that is called glucosuria. So you have to get these things tested. If your sugar level is high in your blood, then they have to test your urine, whether you have a sugar in the urine. So then they say you have a polyuria, you have glucosuria, and because of that you have too much urine or frequent urination in the night time especially. You get up 3-4 times in the night to go to a bathroom for urination. Can you move to next slide, please? Anybody has any questions on this so far between diabetes? Okay, then I move to what is glucose? Why the glucose concentration should be maintained in the blood? Okay, as I show here, glucose is coming from our food, what we eat. Whether you eat rice, whether you eat chapati, whether you eat oatmeal or ragi, everything is made up of starch. Starch is a glucose polymer. That's what we eat every day. That is our major consumption, whether we are non-vegetarian or vegetarian or potato. If American eats, they eat a lot of potato along with the meat, but still the major consumption of food is like carbohydrate. So that is the starch that is completely cut into a glucose molecule before it gets absorbed in the intestine. Okay. If the glucose comes in, as you show in the right side graph on the top right side corner, as soon as you eat, the blood sugar level or glucose level goes up for up to 140 milligrams per deciliter, right? And then it started coming down around 3 hours. Within 3 hours, it will be like coming to the fasting state or even below the fasting state, okay? That is the normal glucose metabolism in our system. That's why the glucose level should be, it goes up and then immediately it goes down. In case if you keep on supplying glucose to your system, if the glucose level is always like 140, if you are diabetic, if you are 140, then what happens is the glucose is stored as a glycogen in the body. Glycogen is a glucose polymer. It's exactly like a starch that is stored in the liver and little bit in the muscle. But that glycogen, when your glucose level goes down, for example, in the graph around after 2 hours after eating, the glucose level goes down, right? That is the time you feel hungry. When the glucose level goes down below 100 milligrams, then you feel hungry. So the liver glycogen gets metabolized to compensate the concentration to the same 100 milligram per deciliter. So that is the constant level, right? So if you have a high glucose, it is used for energy production in the muscle, whereas it is also stored as a glycogen in the liver. Okay, you are going to the doctor to test whether you are diabetic or not. The doctor asks you to come without eating early in the morning. As soon as you go there, they take the blood and check your blood and they say, okay, you are normal 180. But at 80 milligrams per deciliter, you are normal. You don't have a diabetes. But some people cheat their doctors. In India, especially, what they do is when they go to the doctor, a couple of days before or a day before, they do fasting for a lot of time, a long period of time, and then they go to the doctor. That's why there is another way of testing your blood glucose level for 3 months average, how much you had in your blood. That is called hemoglobin A1C data. Hemoglobin A1C is a protein that is on the red blood cell. That protein gets glycosylated. That means glucose is attached to that protein if you have a high concentration of glucose constantly in your blood. So the glucose concentration, the A1C reveals what is your glucose concentration, how you maintained your glucose level in the blood over the 3-month period. So if that level is 7.7%, they express only in the percentage, how much percentage of that A1C protein is glycosylated or attached with the glucose. They say 5.7%, less than 5%, 5.7% is normal. If that is between like a 5.7 and 6.4, it is called pre-diabetic. If it is over 6.5, then they confirm it that you are a diabetic patient. So depending on that, they will start treating you and go from there. Okay, can you move to second slide, the next slide? Okay, here I am showing this. Everybody knows where the brain is, but many of you engineers especially, they don't know where other part of the, especially in the stomach part of the body is in here. So you can see liver, right here it is liver, and this is the stomach. We say everything below our chest is called stomach, but that is not all stomach, but this is the place called stomach. I don't know whether my arrow shows there, but Ilango has to show where the stomach is. And then you come here, the intestine. Small intestine are in the middle, and the large intestine are covering up around the small intestine. So just below the stomach, there is a yellow organ, that is pancreas. Okay, pancreas is the organ that plays important role in diabetes, because the pancreas stimulates the hormone called insulin. Okay, so these are all the things that just you want to know, you want to have something where the liver, where the stomach, where pancreas, and where the intestine. Then we can look at what is the function of each one. Right? Can you move to next slide, please? Yeah, I think probably, can we go to next slide and come back to this slide? I switched the slide somehow. Yeah, no, not before this. Before. Yeah, no, feeding stage. Next one. Yeah, this one. Feeding phase. As soon as we eat, we see this graph shows the same graph I am showing here, the glucose level goes up, right? When the blood glucose level goes up, so what is happening? That condition is also called postprandial state, right? As soon as we eat, within a half an hour to 2 hours, this is called feeding phase, because we are eating and everything digested and gets absorbed in the intestine, and then it goes to the liver first, and then it is released to the blood. Because liver, you have to think, because whatever you eat, it gets digested, absorbed, everything absorbed there is going to the liver. Okay, liver is a distribution center, right? They take everything first and then distribute to different organs, except the fat. The fat, when it gets absorbed, it goes through lymph and then directly go to the blood, and then it is distributed to the bottom of the things